giving me this opportunity to talk this morning. And I will be talking about the weight loss drugs, but I just wanted to give you a background for those of you who are less familiar with YCC Wales, is that YCC Wales are funded by the MHRA and to promote understanding, reporting and research into the side effects of medicines. The MHRA who fund us are the UK government, which is responsible for medicine safety and licensing. And YCC Wales was established in 1983, and we undertake education, promotion of yellow card reporting, have an advisory role. And I'm delighted to say across Wales, we now have over 80 yellow card champions who support us in a role. I would like to share our latest data, which is about to be published in our annual report. But what I can tell you is yellow card reporting continues to increase in Wales. And this data here, the red line is for medicines. The blue line is medicines, including the COVID vaccines. And as I said, you can see we have had an increased reports over the last year. Yellow Card Centre Wales have been sort of active this was our Medicine Safety Day last year. And what I did really want to highlight today, that these are the figures for this year. And as you can see, our patient, payer, carers and consumers are our best reporters in Wales. And I really would like to see this continue. I'll move on. So you may well see the team at various locations throughout Wales, in hospitals, out in community settings. Last year they attended the Eisteddfod, which was very well received, and that includes a vast amount of information down to providing information on yellow card reporting, and down also including workshops for colouring for children. But what I'm going to focus on today is the GLP-1s, or weight loss medications, as the majority of the population probably consider these medicines are for. But what I would like to highlight is these GLP-1 medications are actually medicines that have been developed for both diabetes and weight loss. And so we may have patients who are taking them for either or both indications. Now, this slide here just highlights that these different preparations which are available, not all of them are licensed for both indications. And we can see here, Wegovy, it's not actually licensed for to treat diabetes, but it is licensed for weight loss. And the opposite here for semaglutide, the Ozempic formulation. What we have to be made aware is sometimes we use medications outside of their license. Mounjaro or tirzepatide is actually licensed to treat diabetes along with weight loss management. And the liraglutide is brand specific, and you have to check each product for what its indication is. Now, these medicines, they are licensed for weight loss, as I said, and there are several licensed in the UK. And I think most importantly, there has been cases of people coming to harm from these medications. And what's most important is that these licenses are actually prescription-only medications, and they are available on the NHS, but that availability can vary by location. They may be obtained privately, but that must be following a consultation with a healthcare professional before being prescribed. And this is the advice from the MHRA, which is available on the .gov website, is that people are advised not to buy these from beauty salons or on the internet or anywhere that does not provide that consultation beforehand. These are not these medications. As I said, they're prescription only, and I think there's been some concerns about how people are sourcing these and the advice that they're actually given or the lack of advice. I'm aware of one individual who thought they'd actually purchased one of these medications and they didn't have any instructions with it. And then they took the vial and they had a massive, it resulted in them being hospitalized for a prolonged period of time. Um, the other factor is these are the legitimate presentations are provided as pre-filled syringes and not as a powder uh, in vials that require mixing. And if anybody does actually is prescribed something which is in a vial that requires you to add a liquid to it, that almost certainly is a not a legitimate preparation. And if you suspect you have taken a fake medication or been provided with a fake medication, you are encouraged not to take it and report it immediately to the MHRA, who have the ability to take regulatory action in relationship to these medications. Now, when I agreed to do this talk, this was very topical, was about these skinny jabs, as some people refer to them as. Um, there were cases of individuals becoming pregnant on them. Now, these medicines are not recommended in pregnancy, and there have been cases of people taking them, and the effects of them can last for beyond stopping the medication. And as a result of this, the MHRA has released guidance on their use. And now these medications are not, they're not recommended in pregnancy. They're not recommended in breastfeeding. And that is because we do not have any safety data about these medicines and they potentially could cause harm to a baby. Now, users in the patient information leaflet and their prescribers should be advising them to use effective contraception, and that would be oral contraceptive pill or a non-oral form such as an implant, coil or condom. However, for the preparation Monjaro, this does seem to reduce the effectiveness of the oral contraceptive. And for people being prescribed Monjaro, they should actually be using an additional form of contraception, um, which is the non-oral form, and that would include condoms, um, coils, or other forms of non-oral contraceptives. And that is because the Monjaro may interfere with the effectiveness of the oral contraceptive medications and lead to unwanted pregnancies. This advice is already there in the patient's information leaflets, which should be contained within the packaging that a patient receives. And actually, that's another, if somebody receives a medication that doesn't have an enclosed patient information leaflet, that should raise the suspicions that you may well have a medication which may not actually be one of the prescription medications and could be a fake product. You can find advice on the regulator's website in relationship to this, But in summary, what they have now recommended is that um, these medicines should not be taken in pregnancy, or if you're trying to become pregnant or you're breastfeeding. Now what we do know is that when you lose weight, for some individuals, that they may not have been able to become pregnant before, but their fertility can improve with weight loss. And I think there could be a risk of complacency, particularly if somebody had been trying to lose weight and had historically been not using contraception because and hadn't become pregnant, that they may be inclined to not use contraception, saying, "Oh, I've been trying for years, I haven't become pregnant." And absolutely, you do need to be using contraception with these medicines. The Manjaro in particular, the oral contraceptive pill should be not relied upon, and a barrier form of contraception should be used, possibly in addition. It's really important to have an understanding of these medications and discuss these with your healthcare professional if you have any concerns. After after you've taken the 4 doses in each syringe, any medicine left in the syringe should not be extracted, and the syringe should be disposed of in an appropriate bin. And the other factor is that the MHRA has advised that these medicines should not be used for sort of weight loss for cosmetic purposes. It's more of a medical indication. Now, on stopping these agents, there has also been advice released about how many months following stopping you should wait before trying to become pregnant. And currently, for semaglutide, the advice is you should wait at least 2 months before trying to become pregnant. For tirzepatide, at least 1 month, and the liraglutide. These medicines do seem to leave the body quicker, which means they should be stopped before becoming pregnant, but there's currently not any recommended window to wait. Now, in terms of reporting these adverse effects, they should be reported via the Yellow Card website, and we do encourage people to report adverse effects in pregnancies, and where possible, provide information about the timing of the medicine being taken in relationship to the pregnancy, the outcome of the pregnancy when known, any relevant family history, including obstetric history, and clinical descriptions and results of scans or laboratory tests. So as much information as possible. Now, the other thing I felt I did need to mention today was the biobank study and the GLP-1s. There was a media release in the summer months, and the MHRA are now undertaking a study on these medications with the Biobank Genomics England, and they are exploring the possibility of a relationship between patients' genetic makeup and being at increased risk of pancreatitis when you take these conditions. Now, for those of you who are unaware, pancreatitis is a very serious condition which causes inflammation of the pancreas, and classically patients will have severe abdominal pain that radiates to the back and does not go away. Currently, there's not known to be a link, but there has been an increased number of reports in relationship to these medicines. And this study is being run in partnership with the MHRA and Genomics England, and it is open to the whole of the UK. And they've already had significant uptake. If you do report pancreatitis in relationship to the GLP-1s, the Yellow Card Biobank may get in touch with you, invite you to take part and consent, and you will be asked to provide a saliva sample. So I'm very mindful of time here today. So how can you report? We have a Yellow Card app. You can report via the Yellow Card website, or if you're unsure, speak to your healthcare professional, including your doctor or nurse or pharmacist. And remember, anyone can report. If you have a medicine that has a black triangle figure next to it, these medicines are under additional monitoring. So any serious, life-threatening, disabled, hospitalisation, medically significant congenital abnormalities, or delayed suspected adverse effects. And we can report medicines, vaccines, biological agents, blood products, herbals, counterfeit or fake medications, medical devices, borderline substances, products, and these might include things like vitamin products, along with things like Botox. And fake medicines have been an issue with these medicines, and the MHRA did have a fake medicines campaign which provided individuals, these are all available online, how to protect yourself when you are buying medicines or medical devices online. There's information there about spotting what they call dodgy websites, so unusual web address, poor website designs with spelling, grammatical errors, pop-up ads, exaggerated claims, next day delivery, shortcuts, pressure to buy products. And remember, advertising prescription-only medicines in the UK and their prices on the homepage is actually illegal, and any websites doing so should be reported to the MHRA. Any website saying no prescription is required, payments in cryptocurrencies, or if you're asked not to name the medicine. Okay. And you might identify a fake medicine as bag packaging, missing an UK-only label, actively ingredients missing from the package, poor quality tablets, capsules crumbling. And if you have reported, if you do believe you've taken a fake medicine, report it to the MHRA, who have the ability, via the Yellow Card scheme, who have the ability to take action and prevent others coming to harm from these. So I think I've been relatively timely, but I'm mindful it's almost 12 o'clock. So any questions?
Oh, thank you, Alison. And presumably